is a senior center in the Lower Shore, and the Alzheimer's Association, of course. You're going to hear from a few of our sponsors via video because I just wanted to share a little bit more about themselves. But before the video, we're going to see our Caregiver Conference Planning Committee. And of course, without anyone on this list and many, many more folks, this planning wouldn't be possible, and I can't thank you all enough.
Greetings from the Eastern Shore of Maryland. I'm Mary Angela Baker, a volunteer with AARP, serving on the Executive Council of AARP Maryland. Thank you for joining us for these caretaker seminars. You'll find them to be practical, engaging, and informative. The presenters are experts in their field. Their work is research-based and accessible. I hope you'll find they'll have utility in your day-to-day lives. As always, AARP is here for you, dedicated to your success.
At Gold Creek, you can count on us. Our dedicated assisted living and memory care team are here for support during this challenging time. We are doing everything we can to allow our residents to connect with their loved ones. Our residents are like family to us, and we are grateful to be able to support them and keep their spirits lifted. The safety of our residents and staff is our #1 priority, and we are committed to continuing to be Gold Creek strong.
Good afternoon, everyone. I'm Amy Fager with Care Patrol of Delmarva. Care Patrol is a free community service that helps seniors and their loved ones find safe care options, whether it be in-home care, assisted living, memory care, and even independent living. We can help you navigate through the entire process from start to finish. Call us today for a safer tomorrow at 302-524-8237.
Okay, now it's my pleasure to introduce our speaker, Sarah Locke. Ms. Locke is Senior Vice President for Policy, Brain Health in AARP's Policy Research and International. She leads policy initiatives on brain health and care for people living with dementia, and is Executive Director of the Global Council on Brain Health, an independent collaborative of scientists, doctors, and policy experts convened by AARP to provide trusted information on brain health. Ms. Locke serves on the steering committee for the National Research Summit on Care, Services, and Supports for Persons with Dementia and their Caregivers, on HHS's Administration on Community Living Aging and Cognitive Health Technical Expert Advisory Board, and on Dementia Friendly America's National Council. Prior to AARP, she served at the Department of Justice, the Office of Congressman Michael D. Barnes, and at the firm Arent Fox. She holds a JD from the University of Maryland, and I'm delighted to introduce Maryland resident Sarah Locke. Thank you, Sarah.
Thank you so much, Cindy. It's terrific to be here virtually with you. I actually live outside of Annapolis in Davidsville, where it's been raining, but it looks like it's going to clear up for a little bit. So I'm going to share my screen, and hopefully you guys can see my slides.
Sure. And just so everyone knows, we are going to have everyone on mute, and we're going to keep our video feed also quiet, so we can have the focus on Sarah today. If you have questions, and we hope you do, or comments, please write them in the chat box, and we will, attend to them. And we just are delighted to have everyone here today.
So it's great. So can you see the one big slide?
We see both.
You see both. So let me switch settings, and hopefully, how's that?
Perfect.
Okay. Thanks, Cindy. So I want to thank the Alzheimer's Association of Greater Maryland for this opportunity, along with each of the sponsors. Of course, I'm excited that ARP is one of them, but the other sponsors listed in part of the caregiving advisory committee that decided to put this program on. I hope it's of help. I do want to emphasize something that Cindy said, which is I'd love to hear what your questions are. And so if you use that chat function, it'll help us have more of a discussion. I've got a lot of slides, but I'm hoping to move through them relatively quickly so we have an opportunity for Q&A at the end. So as Cindy said, we're going to be talking about effective strategies for brain health and opportunities to reduce risk for dementia. Because AARP and our many partners, which included the Alzheimer's Association and many other groups, just recently released a report on women and dementia. I am going to be spending about half the presentation in the second half talking about that. But I'm just curious from a chat perspective, if most of the listeners are women, or if I've got a few men in the listening audience as well. So just to test out that chat function and whether you can work it, just tell me whether you're a man or a woman. And we'll see what brings after that the chat function says. So getting started, I wanted to tell you a little bit about AARP. I'm hoping that most of you know AARP, but if you're familiar with us, we are a non-profit, non-partisan membership organization of over 30 million people. But many of the people who know AARP think of us as an insurance company or something like that, but that is not what we are, although we do work with products and services and discounts to bring our members value and good products. Our primary role is to empower people to choose how they will live as they age. And that is a mission we take very seriously. And in fact, one of the reasons we are in the brain health space now, because ARP is continually asking our members, surveying both our members and all people 50 plus, but we also do a great deal of surveying of people's attitudes. And one of the things that we ask them is, what concerns you? What are the issues that really concern you about aging and just about life in general? And as a result of all of those extensive surveys, we know that people are really engaged in the topic of brain health. And over 98% of adults 40 and over believe that brain health is very important. That makes sense when you think about it, because having good brain health kind of makes your life work well. And if you don't, then life can be a lot more challenging. So based on our surveys and understanding that this is one of the most important issues, we dig a little deeper and ask about people's attitudes and behaviors that they're currently engaging in. Now, we have surveyed over 30,000 people on these questions over the last 5 years since we founded the Global Council. And we take a lot of time and effort in assuring that we're reaching a representative population and that we're reaching a multicultural community. So we oversample and look for similarities and differences in the African American community, in the Latino community, in the Asian American Pacific Islander community, and see what are the differences that are reported. But overall, 98% of adults 40 and older think that brain health is important. And if you ask them if they're doing the things that are most important to protect their brain health, about 56% will say that they are. But when you dig deeper, you find out, well, not so much. People think they may be, and they think they may know, but if you get and ask them, so specifically, how many days of the week are you exercising? What kinds of food are you eating? And you analyze those responses, you realize that a lot of people really don't know what is good for the brain. And that was one of the reasons that we established the Global Council on Brain Health. And that's because many people simply do not know which are the activities that will help their brain. And that's because there's a lot of conflicting science and reporting out there about what it is that you can do, if anything, to improve your brain health as you age. And so the Global Council was formed to provide trusted information on how to maintain and improve our brain health, with a vision that all people in the United States will have the tools at hand to help them maintain a healthy brain throughout their lifetime. Now, ARP doesn't have a stable of scientists just sitting around waiting to give us the answers. So we've been partnering with some of the world's greatest experts, and we've established a network of over 150 brain health experts. 14 members of our governance committee have been with us since the founding, which was 5 years ago. And then for each topic that we focus on, 106 issue specialists help us determine the science around each of the lifestyle issues and things that our members and others have told us that they think may be good for their brain health. And because the answers don't all reside in the United States, we've asked representatives from 26 different countries and 87 universities from around the world to help us distill what works and what doesn't to keep your brain sharp as you age. And on the screen, you see some of the examples of some of our partners. And in that 5-year period of time, it's a little slow, we have completed 9 reports and 12 infographics. And that's because not everybody wants to read 40-page reports on the science. They say, just give us the facts, right? So we have available on our website at the Global Council on BrainHealth.org, and we run it all together, all one word. You can access each of these 9 reports if you want to do a deep dive into all of the science behind them. But we also have done infographics, which is kind of a 1-page highlighter of the things that you should do in order to preserve your brain health. And I can tell you that we have all of the reports in Spanish. So if you speak Spanish or know people that do, those are also available in Spanish. But the infographics are some of the things that a lot of people are after. And we have those in French and Spanish, Chinese and Arabic, as well as English. So if you know people, they're great 1-page takeaways if you're interested in seeing that. But we've done reports on physical activity, sleep, social engagement, engaging your brain, which is cognitively stimulating activities, and nutrition, mental well-being. Lots of people want to know what doesn't work. And so supplements, although it's a billion-dollar industry, they're not proven to help your brain health. Although our surveys show about 25% of adults 50 and older are currently taking a brain health supplement. And unfortunately, it means that we've got very expensive urine, but not a lot of help going towards your brain health. 3 reports or 2 that we've already released this year: the relationship of brain health to heart health and delirium. A lot of people don't realize, even when you go into the hospital or you are having surgery, you're increasing your risk for cognitive issues. And so we, in February, released our March, our report on delirium and what you can do to reduce risks of delirium if you have dementia or if you have cognitive decline. And we're getting ready to release our music report, which is everybody's looking forward to. So as I mentioned, not everybody's up to reading 40-page reports or even one-page infographics. So ARP has developed a digital platform called Staying Sharp, in which we present a holistic path to brain health. And it's based on the 6 pillars of brain health, which is really based on the Global Council's synthesis of the state of the science. And I'm going to spend some time going through that in the presentation today with you all. We've really distilled it down to 6 pillars, and that's be more is how I remember it as an acronym, acronym, but be social is the first one. And social connections are incredibly important. Engage your brain is another. Managing stress, get ongoing exercise, nutrition, and restorative sleep. And sometimes I think this is everybody's favorite. What do you need to do to eat right to promote your brain health? So I'm going to go over some of these. Now, Staying Sharp is available to all AARP members, and it's part of membership. And there is a unique assessment available where we're not only assessing what you do in these 6 pillars of brain health and how you're managing it, but we marry that with a cognitive assessment and then give you the results, so that if you take the cognitive assessment and you evaluate both your lifestyle and your cognitive assessment, then the Staying Sharp algorithm can help give you science-based recommendations for how you might be able to improve your health. But I'm going to give you a high-level summary of it. If you are an ARP member, I hope you check out the Staying Sharp platform. And if not, check it out anyway. You can get it if you're not a member, but it is not part, but for an additional charge. So what I wanted to talk to you about is engaging your brain, is learning new things. That's what we mean when we talk about engaging your brain. And it's really about discovering and learning new things. So studies have shown that challenging your brain in new ways, or basically think about it as exercising your brain throughout your life, that this may be able to strengthen it. Our brain is stimulated and grows when we learn new things and pursue new interests. We actually can develop new neural pathways even as you age. And so it's important to stay curious and give yourself a good mental workout by doing something that actually challenges your thinking. It's important that you enjoy it, of course, because you won't keep doing it if you don't. But the idea is to go deeper, grapple with new and complex ideas, and that can help challenge your thinking. So the Global Council has made some recommendations in this space, and it's things like take or teach a class. You guys are all on this webinar, so you're well on your way, right? Because you're learning new things and engaging with new material. But learning a new language, and yes, it's possible to learn a new language no matter how old you are, although it may be a little easier when you're younger. If you keep it up, even with age, it's never too late. Try complex arts and crafts. We're not talking the same old, but continually deepen your engagement in your art or something that you love to do. And it keeps challenging your brain, which can open up new possibilities for you. Now, this is not the same as to say that the brain games that you hear advertised are necessarily improving your function, and they are not going to prevent cognitive decline or dementia. But these kinds of things that are normally thought of as brain games, clinical trials have not proven that playing games will prevent a degenerative disease or the onset of Alzheimer's. While there is evidence that brain training can improve performance on the specific skills that you're training on, there's very little evidence that they're going to result in better everyday cognitive function. And more research is needed, and certain games are better, but there's not a lot of science out there that's saying if you play Sudoku, for example, that you're going to be able to balance your checkbook any better. But the experts that we convened said doing those kinds of things keep you engaged and challenge your brain, and they can't hurt. Now, where you have to really pause is if things are too expensive for you and people are charging thousands of dollars and asking you to part with a great deal of money that you don't have in the hopes that you're going to prevent Alzheimer's disease. It's probably not a very good use of your money. So taking a class and staying engaged in society and doing things much more likely to help you, and going to cost you a lot less. So things that the Global Council recommends is that you stay social. Being engaged and using your mind and staying social are actually two very related concepts. Staying engaged with friends and family and avoiding social isolation, which the National Academies has recently come out and said can be actually a great risk factor for dementia. Enjoying the companionship of others and even a pet, or volunteering and feeling purpose in life. These are things that can really help keep your brain sharp as you age. Now, some of these things about staying socially engaged might be a little harder now that we're going through the coronavirus pandemic and we're trying to socially distance so to protect ourselves. But there are other ways that you can. Now, obviously, you guys are on this webinar. Now, we normally would have been all together physically, maybe at Easton or someplace else to be together, but you're still getting some of the benefits, and that's why I want you to make sure that you ask questions and participate in the chat so that we can see what your questions are. So studies have shown that people who are physically and mentally healthier if you are not socially isolating, and connecting with people, as I mentioned, is stimulating and adds meaning and purpose in people's lives. In fact, experts say social connectedness is a key predictor of health and independence in later years. So the recommendation is to make sure that you stay engaged and seek out people who may share your interests. And, you know, if there aren't a lot of people around, try furry and feathered friends. Not only can they bring great joy and purpose into our lives, but they often present opportunities to engage with others who are out and walking. And I think one of the best pieces of advice that you can give for brain health, frankly, is walk your dog, even if you don't have one, right? Exploring volunteer opportunities nearby, like the Alzheimer's Association or ARP. They have great opportunities to get you engaged in activities. So I would say, you know, FaceTime and Zoom are important substitutes for social networks. Video, iPhones have created great opportunities, but, you know, a lot of people don't have access to those. Now, it doesn't count for you guys because obviously if you're here listening and participating in this webinar, you have access to broadband or Wi-Fi, and so that's great. But you have to look for other opportunities over your phone, for example, if you're not. So here are a couple of other recommendations to get involved, but let's move on to the next pillar. And that's because ongoing exercise is really important. Getting 150 minutes of exercise each week is the recommendation. And physical activity helps in a number of ways. Everything from increasing circulation to repairing, actually fostering the brain chemicals, in the chemicals operating in your brain, reducing anxiety and improving sleep, and reducing your risk of other health factors like heart disease, depression, and stroke. These are closely related to dementia and often coexist, or are what we call comorbidities. So if you can lower your risks of diabetes, heart disease, depression, and stroke, you're moving in the right direction to protect your brain. And you don't have to be a marathon runner in order to enjoy the benefits of exercise. Things like strength training, dancing, running, biking, walking are all good for you. What's important is that you do it regularly and you get at least 150 minutes of exercise each week. So people will tell you move about 30 minutes each day, and walking is a great start. So here are specific recommendations. Now, we don't have evidence that one particular form of exercise is necessarily better than others. But what I want to emphasize here is it's not just the purposeful exercise. And this was one of the biggest takeaways I got from our Global Council meeting, is that it's not just the 30 minutes that you say, I'm going to spend taking a walk or going to the gym. It's important to move throughout the day. The walking and the activity, and you're not sedentary all the time, is an important element. And I would add strength training to your exercise routine, because often building up muscles and helping maintain a strong core are things that will benefit you in the long run in decreasing the risk of falls, improving how you move in the space, and getting your blood pumping and circulating in different ways, and building up your structural muscular strength is important. And so that the Global Council, if you actually go to our website and you look at our infographics, you'll see our one-pager talks about the 150 minutes broken up over the week, but it also says at least twice a week you should do some strength training exercises. So what I said is everybody's favorite. People want to know, okay, what is it that I can eat? Or what should I not eat that will help protect my brain as I age? Well, the number one recommendation that my nutrition experts provided was increase your vegetables, and especially your leafy green vegetables and your berries. That by substituting healthy green vegetables, beans or grains for other types of food that may not be as good for you, you can make significant inroads into a healthy diet. So it's really not a particular specific diet that has been proven to maintain or improve your brain health, but certain kinds of ways of eating is what seems to help cognition. So you may have heard about the Mediterranean diet. That's high up there in those recommended diets, but it's not the only one. So for example, the Global Council looked very closely at the Mediterranean diet, but we also looked at the DASH diet, which is known as the dietary approaches to stop hypertension. This is the intersection of good heart health and good brain health, where you reduce the amount of salt that you are consuming. You reduce the amount of fatty red meats or fats from dairy and butter, and increase the healthy fats, like those that you get from using olive oil. That's the DASH diet. The my diet is a combination of the Mediterranean DASH diet and was actually started by one of the former members of the Global Council on Brain Health, Martha Claire Morris, who unfortunately recently passed away in Chicago, but she was a great researcher in this field. And I love to think of her in this picture I see of her with her hands on her chin, surrounded by strawberries and blueberries. That's whenever I think of Martha Claire Morris, Dr. Morris, I think of her in that picture with those berries. So if you look across all these different diets, like the ones I've just mentioned, the Nordic diet, the Japanese diets, where their cultures are known for having good brain health and fewer incidences of cognitive decline and dementia, you can see the patterns. And it's eating less meat and sweets, cutting down on salts, although some of the diets, like some of the Asian diets, can be relatively high in salt. But most of the other diets reduce the amount of salt in the diet that a lot of Westerners typically consume. So consume less red meat and sweets and salty foods, and consume more fish, nuts, beans, grains, leafy green vegetables, and healthy fats such as olive oil. So in general, I'll tell you that the field of diet and brain health is very young, and we had robust discussion amongst the experts about whether you should have butter or no butter, and good fats versus not so good fats for you. In general, the recommendation is to reduce it and go with substituting more olive oil, but nobody is saying don't ever eat any butter. It's just reduce it. But there are gaps that still exist in our knowledge of the effect of nutrients on brain function, and more research is needed before it's definitive. But most experts will agree that things like fish with high omega-3 fatty acids are very good for you. But you don't always have to get it in from a fish source. There are, flax seeds is high in omega-3s, other kinds of nuts like walnuts and almonds. But none of these are absolutes. You can't just eat tons of walnuts and almonds and expect to have good brain health. You have to eat a healthy, balanced diet. And instead of so much salt, you can substitute spices that liven up your food, like vinegar, lemon, herbs, and spices. Whole berries, we're not talking about drinking a ton of juice because it can be very high in sugar. Substitute water oftentimes is a good strategy. And if you're like me and can't stand kale, find the greens that you really like and eat those instead. Sleep. This is one of my favorite topics, and people as they age are very interested in sleep. And I'll tell you, I think if I've made any major change in my own lifestyle as a result of learning what can effectively help my brain health as I age, as a result of learning from the sleep experts that we worked with, it is to try and get 7 to 8 hours in a 24-hour period. Our culture in the United States tends to look down on people who really, it's a badge of honor to claim that you don't sleep much. But as I have gotten older, sleep has become more important, and I realize I can't function well And I don't know if you feel the same way, but it makes a big difference when I've gotten good sleep. What was interesting to me is you don't have to get necessarily this 7 to 8 hours in a single stretch. If you think about other cultures like the Spanish siesta, entire cultures have grown up around maybe getting an hour of sleep in the middle of the day. It's about a 24-hour period. So getting 3 or 4 or 5 hours, waking up, trying to get it's a matter of consistency and routine. So practicing good sleep techniques so that you can get 7 or 8 hours in a 24-hour period, making sure that what they call practicing good hygiene or good sleep hygiene is something that you are very conscious of doing, can help you get the sleep that you need. And sleep changes as you age, but if instead of fighting those changes and instead you kind of go with your circadian rhythms, you can actually really help yourself get the sleep that you need. It's completely normal for sleep to change as you age, and that you get tired in the evening earlier and you wake up earlier because your bodies actually do shift. You know, in Maryland, it's a big push to try to change school hours, right? Because teenagers sleep late and stay up late. And shifting school hours is said to really improve cognitive performance for kids in schools. So while that struggle is happening, and if you've got teenagers, you realize that it's not just easy for them to fight those rhythms. If you give yourself the same slack and treat yourself to trying to get to bed earlier and wake up earlier so that you're not fighting your natural circadian rhythms, you'll feel better. Some tips you probably are familiar with: adjusting your caffeine intake if you're having trouble sleeping. Make sure that that dog that we've recommended is not disturbing your sleep. If they're sleeping in the same bed and waking up because they've got to go use the bathroom, then they might be really harming your sleep. So you might want to rethink where your pets are sleeping. And you don't want to deny yourself the fluids that you need, but make sure that you're drinking ahead of time so that you're not going to have to wake yourself up in the middle of the night. And it's really smart to keep those smartphones out of your bedroom and the electronics so that the light from those pieces of equipment are not interfering with your sleep, and so that you're not tempted to text your buddy in the middle of the night. And the sixth pillar, which kind of is the summation of all the ones that have gone before, because if you want to manage your stress, dealing with the other 5 pillars are how you can effectively manage stress. Now, nobody lives a stress-free life. And in fact, our expert said having a stress-free life is not good. In fact, that's just the normal part of living. But it's how you manage and how you cope and whether you're resilient in times of stress that helps your brain. And so the recommendations about how to deal with those stressful situations, and boy, with COVID, now we're getting that stress in spades. Exercising regularly, taking the time to smile or find things that make you laugh, distracting yourself with music and reading, and then going out and getting that exercise, so taking a walk, going to a park, getting in touch with nature has been shown to really significantly help your brain health. Now, I mentioned at the beginning of this presentation about how we like to survey all of our members and people who are non-members 50 plus. And I can tell you that we've recently fielded a study in relationship to our music survey that we can compare the results, because in every one of those surveys over the last 5 years, We've used standardized batteries of anxiety and depression and evaluated people's mental well-being. And we've noticed a marked increase in anxiety and distress of people 50 plus. So we know people are under a lot of strain and stress. So all of these measures are especially important to take care of yourself now. So in addition to the 5 pillars that I talked about, confiding in friends, taking the time to be silent and still, taking stretch breaks, not only physically is it good, but it's mentally good for you. Limiting screen time so that you're not constantly getting barraged with the bad news of the day. Taking time to take a few deep breaths can help significantly. Now, no conversation about brain health would be complete without talking about the things that actually act as threats to brain health. And by trying to eliminate these things, you will also be improving your brain health. So if you smoke, stop. If you are feeling symptoms of depression, often dementia and depression are closely linked, and sometimes people don't know which comes first. But managing it or seeking professional assistance can really help, as can some of the engaging in these other pillars. Certain medications can make you cognitively foggy, and lots of times in the way that people are over medicated or getting multiple medications, where their healthcare providers may not know everything that they're taking, including supplements. Those sleep aids that people take can really wreak havoc with your brain health. So take a look at some of the recommendations that we have both in the sleep report and in the supplements report, which goes into a much deeper dive than I have the opportunity now to talk about which medications you might want to avoid. Diabetes, hearing loss, and heart disease. I just want to say, with respect to hearing loss, the Lancet reports that hearing, as I happen to look up a window, an enormous deer is walking into my garden, starting to eat everything. So I'm going to open the door and shoo it away, and hopefully that will help, because my daylilies are going to disappear. Go! Sorry. Anyway, hearing can be a significant factor, especially for older people. So get your hearing checked and see if you can get it alleviated, because hearing loss is a significant component to contributing to risk for dementia. And everybody always asks, yeah, I'm getting older, therefore I'm really interested in knowing what I can do. Is it normal aging, or is it dementia? Or am I starting to slip? Oftentimes, it's normal for people's memory to not be quite as good as you age, but there are things you can do to improve your memory. And sometimes it's not that you don't necessarily remember, your memory skills are gone, but you may not be paying attention or listening carefully. You're busy working, taking care of your kids, helping be a caregiver for somebody living with dementia. You've got no time, and you're busy focusing on a million other things. So lots of times you are straining your memory and not giving yourself an ability to remember things. So take breaks, use calendars and reminders. All these things can really help improve your memory. So what can you do today? Don't try to bite off all of these things. Pick one thing you can do that might help your brain and give it a try. Think of small first steps, like if you're not walking, if you're not out exercising, can you do a 10-minute walk? Can you add one serving of vegetables? Write down what you will do and when, and commit that small thing to take for self-care and self-preservation, and try to stick to it. See if you can do it for a week. And if you get support from family, friends, or community groups, it can often help you stick to your resolution. So I'm going to pause there because I see that I'm well into my presentation, and I'm going to talk about women next. But I thought I would pause and see if my friends at the Alzheimer's Association had any questions or any thoughts they wanted me to address before I went on to the women's part of the presentation.
Don't see any questions, Sarah, yet in the chat box, but in response to your initial question about gender, it does seem like the majority of our participants are women.
Great. Did any step forward?
I'm sorry, I didn't catch that.
Did any of the people identify as male?
Yes, there are a few men.
Okay. So it's great to know that we have a mix, but mainly women. And that's not surprising to me because women actually often carry the greatest burden when it comes to dementia. And it's a women's issue that a lot of people aren't really aware so much. And so last year at the Alzheimer's Association International Conference in Los Angeles, along with Maria Shriver and the Women's Alzheimer's Movement, we gathered about 75 people together to brainstorm about what we could do about women and brain health. We had we brought scientists, part of the Global Council on Brain Health, and policy experts together to see if we could brainstorm to think about how are we going to move the field forward. And what you see on the screen now is an image of the graphic description of what that meeting produced. And coming out of it, May 21st, we presented a report of the results of this collaboration of all of these researchers and policy people coming together to think about what we could do over the next 10 years to make a difference. But I wanted to share a few statistics about women carrying the heaviest burden for dementia. And you can find some of these facts at the very back of its Time to Act. In fact, the Alzheimer's Association provided a great 2-page report, fact sheet from the Alzheimer's Impact Movement in same time as this report came out. So we included it at the very back of statistics of women in Alzheimer's disease. So lifetime risk for women after the age of 45 is 1 in 5, whereas for men it's 1 in 10. So you have a much greater risk if you are an older woman than if you are an older man of living with dementia. And 2/3 of the people today who are currently living with dementia are women. So it's not just a question that women are the primary people who have dementia, but women also make up 61% of the caregivers in this country, in the United States. So by the time a woman reaches age 60, she has more than twice the risk of developing Alzheimer's disease than she does of breast cancer. And in the caregiving space, because of the historic fact that women are much more likely to be caregivers in their families and much more likely to have jobs with lower income and have lower education, there are many reasons that women traditionally have, both from a lifestyle perspective, had more difficulty engaging in some of the healthy behaviors that we've discussed, but economically are in a worse situation because they are more likely than men to have to give up their careers and their jobs or cut their hours to provide care. But the report that the Alzheimer's Association and the Women's Alzheimer's Movement with Maria Shriver did 10 years ago, which AARP supported, found that only 17% of adults recognize that women have a greater burden when it comes to dementia. And if things keep on the current trajectory and women don't change their activities so that they're reducing their risks for cognitive decline, and still shoulder the greatest burden for dementia, we're expecting that more than 9 million women in the US by the century turning, getting to 2050, will have dementia. So I'm running low on time, but I wanted to say this is the report that we've put out. If you go on arp.org, you can find the latest report. We don't want another decade to go by without making greater progress. And so our key strategic action plan, which I'll share with you, is a result of this collaboration coming out of this brainstorming session of researchers and scientists and policy people and caregivers and people living with dementia coming together and agreeing that these are the 5 steps that we should be putting in place to improve the conditions for people. And if you ask people living with dementia, what's the number one thing that they think we should tackle first? They'll tell you eliminating the stigma of dementia is an incredibly important aspect of it. And that's because stigma often gets in the way of people getting tested, people getting diagnosed, people admitting that they have it. So we need all of society to recognize dementia as a public health problem for which women pay an exceptional price. It's not a normal feature of aging, and a lot of people don't know that or are not aware of it. And stigma stands in the way of early detection and early interventions. We all have a role to play in stopping this. People with dementia who use their voice are very powerful in this space, but we need policymakers, researchers, healthcare providers, and individuals to come together and tackle the stigma of dementia. Empowering women to promote their own brain health is the second step that we've talked about, and the elements that I've just gone through are what we need people to actually practice, to first understand that these things work and that they can make a difference. Investing in research that's inclusive. We need to learn more about the causes of Alzheimer's and dementia in all women. Science has to accelerate efforts to understand sex-based differences in dementia and why some women are more resilient to cognitive decline than others. We need this knowledge to develop better treatments for all, because it's not just because women live longer that they have a greater risk for dementia. And we need to understand things like menopause and dementia and the numbers of children and its impact on relative risk. Supporting family caregivers is incredibly important. As we've learned with COVID, people who are the caregivers need paid leave and need their own health care if they're going to help the people they're trying to provide care for. But we want employers to step up and provide paid leave for employees who provide care at home. And if we're going to make life better for those caregivers, both as caregivers and when they get older and need help, we need to give help to them now. And finally, improving medical training for dementia. Fact is, healthcare providers can do a better job of recognizing cognitive decline in older women. And oftentimes, because women tend to be more verbal, some of the tests that are given make women seem to be more cognitively intact because of their higher verbal skills. So we need to start thinking about changing some of the tests that women are given to detect dementia or cognitive decline. And we've got to get healthcare providers to stop saying that there's nothing to be done about cognitive decline and dementia. The same steps that we talked about that can reduce your risk, improve the quality of life for people who are living with dementia. So it's important for healthcare providers to be able to refer people to these evidence-based lifestyle suggestions that can improve quality of life for caregivers and for those living with dementia. A team-based approach is needed, and we, like I said, challenging the outdated notion that there's nothing you can do about dementia has to stop. So I've gone through each of these and I've tried to abbreviate it. I wanted to leave you guys with, again, pointing out the resources that the Global Council on Brain Health provides. I mentioned each of these reports, so there's a wealth of information available to you. And I just thought I would leave you with a preview of the stuff that's going to be coming out of the music meeting, which is music is good for your brain as you age. Now, we can't say it prevents cognitive decline, and we can't say that it prevents dementia, but we know that music impacts different regions of the brain, including all of the elements that are important for memory and cognitive function, like hearing, focused listening, and movement. And it can improve your overall quality of life, your mental well-being, social connection, and reduce stress and anxiety. We have specific recommendations that will be coming out for people who are caregivers of those living with dementia, because it provides a great way to engage even at the latest stages of dementia with the people that you love. So ARP's commitment to disrupting dementia, you can find out more at arp.org/disruptdementia. And I will leave it at that. How much time, if any, do we have left?
Thank you, Sarah. We have just about 3 minutes left. If anyone has any questions, now would be the time to ask them. Feel free to type it in the chat, or you can raise your hand. I do see, thank you, Cindy, shared one of her favorite books on brain health, and one of hers is Outsmarting Alzheimer's by Dr. Kenneth Kosick.
Mm-hmm.
Does anyone have any favorite movies about Alzheimer's they'd like to share?
Sarah, I have a question.
Sure.
McGean. Because of your role on the, I think it was National Council, if I'm recalling correctly, can you talk a little bit about the impact of the dementia-friendly movement on decreasing stigma, and whether you feel like that's the best way to go for communities? I mean, I know it's probably a multifaceted approach to decrease stigma, but I'm just curious because you've been active in that Dementia-Friendly America.
Yeah, I really do think that that's an important element. Dementia-Friendly America is doing dementia trainings where people become familiar with dementia and they see people out living lives with dementia and understand that it's not something that you get one day and it's over. So I think that the dementia-friendly movement is hugely important, and I'm actually working with the World Dementia Council where we've done a review of many dementia-friendly communities to see what is common and that actually works. But the evidence is out a little bit because it's relatively new. We're looking at, proven benefits for dementia-friendly communities. But I think reducing stigma is one of the best things, and that we're finding positive results from. Just that if people understand what dementia is, they're much less likely to be afraid of it. And if they see that people living with dementia can engage and are part of the community, it changes their entire perception. So it's a great question that I appreciate, and I encourage more communities both to be age-friendly and dementia-friendly, and think about what are the special needs of people living with dementia and their caregivers so that they can really be included in the community.
Thank you.
Thank you. There is a comment, somebody is wondering if you have any thoughts on melatonin to aid their sleep.
Yeah, that's a super controversial point, and I recommend you take a look at the report on supplements and on sleep, because we go into that quite a bit. But the shorthand is there's evidence on both sides. If you talk to European experts, they're much more likely to say melatonin, it can be useful, but I would say it's not very well studied. And so you'll look at the council's recommendations. I was going to see if I could find it word for word so I didn't get it wrong. But in essence, they say if you can avoid melatonin or other sleep aids and instead institute good sleep hygiene as a first line of defense, go there. But certainly do not take melatonin with lots of other sleep aids. That is a clear no-no.
Mm-hmm. Thank you. In addition to another recommendation, someone is asking about red wine and whether or not that is good for you, because now they're hearing differently. Do you have any thoughts on that, Sarah?
I do. I myself drink red wine, but the recommendation of the council is don't start if you are not already consuming. And do not take excessive amounts of it. In fact, there's no amount of alcohol that has been proven safe for you, and there are lots of other harms to it. Now, the reason that there's so much evidence on the other side is A, people like alcohol, and it's part of the Mediterranean diet that is thought to be so good for you, right? So after careful consultation with the experts, they say there's no real difference between white wine and red wine. So a Mediterranean diet doesn't say, and the DASH diet that was incorporated included 1 glass of wine with food. So if you're going to drink alcohol, moderate amounts and with food is the way it's been shown to be most beneficial. And that, along with what they call the French dichotomy, is that often the French diet has a high fat content, but they're drinking lots of red wine. It's thought that the tannins and the content of red wine, which is the same that you get in berries, those phytonutrients, are thought to be very helpful. So I myself continue to drink red wine with dinner, but the amount of wine that is in a typical pour is much smaller than you think, than most American restaurants will serve. So go ahead and enjoy that red wine with dinner, but it's 1 glass for women, no more than 2 for men. And typically, if you think about the size of men versus women, that's why there are reduced amounts for women. And also, as you age, your ability to tolerate alcohol goes down. And your sleep patterns actually can get messed up as a result of too much alcohol. So I'd be very careful about the quantity, and certainly don't drink it just to improve your brain health.
Got it. There's also someone inquiring, can you talk a bit about eye health and the relation to dementia?
Yeah, so what I would say is we have not yet done a global council review of that. So I don't have as much information at my fingertips about that. But I know that sight and vision and the inability to see well is a reduction of your sensory intake for your brain. And so that has been linked with dementia. And there's lots of science around your eye health and what's happening with your eyes, and that in fact you can take a look at your eyes to give you a warning sign for dementia. But I don't know a lot to tell you much more, other than it's a developing area, and that scientists are looking at it as a mechanism of diagnosis, but not being able to see is very disorienting. And especially if you're talking about delirium or other things, it's really important to get your vision corrected if you're having trouble seeing, because good hearing and good sight can help forestall cognitive decline as you age.
Great, thank you. There is a comment here Amy, I see your father suffered multiple mini strokes that caused what they called dementia. And then a nurse advised you that he was not eligible for services because the definition of dementia meant he was not able to learn. So is this something that needs to be shared with educators and professionals like nurses, et cetera? We do absolutely want there to be education across the board with, you know, nurses, physicians, anyone working with people with dementia. We do believe there sometimes needs to be a little bit more education, and that is something that we do push for. I don't know if you have any thoughts on that, Sarah, and just to add to that, Amy, your father is definitely eligible for services. All you would have to do is call the Alzheimer's Association.
Yeah, and that definition of dementia as not being able to learn is not one I've heard of before. So I would certainly challenge that definition.
Yeah. Any other questions? I do want to point out that this is our first webinar in a series of 3. So for the next 2 Thursdays, again at 1 p.m., we will be having additional webinars. The next week's is on nutrition and dementia. And then the 3rd week on the 25th, we will be watching a short film called A Good Man, and then just having a little discussion on that. And the film is just about 15 minutes long.
Right.
And you can go to alz.org/CRF, and that's Community Resource Finder, to register for those programs.
I put the links too for the bit.lys in, this is Cindy. I put the links for the bit.lys for those 2 weeks in the comments. And Sarah, I just want to say I can't thank you enough for this fantastic presentation. I think the resources, the research of that AARP is able to do in the Global Council on Brain Health is just amazing and astounding. Thank you for all of this. I can't wait to read some of these reports when I get a chance, but before that, I'll definitely look at the infographics. I love infographics, and just wanted to thank you for your time. We could spend 4 hours, we could spend weeks on this topic. I do want to remind everyone on the chat and on the program that our international research conference is a global conference that's actually going to be held in a webinar fashion in July. So look for that if you're interested in attending some of the sessions. It's free, so it's amazing. So please keep that in mind. Please keep, just in general, the Alzheimer's Association 800 number in mind, 1-800-272-3900. Folks there can answer questions, help you get connected to services, and register for all kinds of programs that we have coming up. We thank you so much for joining us today. I don't know how to clap, virtually, but and hug and everything else, but thank you. I just can't thank you enough.
Oh, it's my pleasure. I had a lot of fun putting it together. Thank you for asking me. I'll just tell you, I'm going to be at AAIC, even virtually. We're presenting our results of our music report in a poster presentation.
Perfect.
So
I'll sign up for that one for sure.
Yeah.
So
good.
Thanks so much.
It's going to take a village, right? To and we just have to prioritize ourselves. That's the other thing.
Absolutely. Yeah. So have a great rest of your afternoon, and make sure you get up and walk.
Yeah, exactly, after an hour. Thank you very, very much.
Thanks, everyone. And someone is asking for your email address, Sarah. I don't know if you want to share that, but
Sure. My email is slock, SLOCK, at aarp.org. So it's slock at aarp.org.
Thank you so much.
Thank you.
And we have recorded this presentation. If anybody would like to have a copy of it, just send us an email.